All I can say is that I have real concerns now about women having lower levels of estradiol, like in the 80s or something. If we look at this study and then giving them 200 milligrams of progesterone and then thinking that I'm doing good, maybe I'm not doing so much good. Maybe I'm knocking their brain out, like I'm sedating their brain too much, and maybe I'm not helping their vascular system. So it's like, I'm really at a crossroads here. I've just let you know that I really feel conflicted about giving the progesterone 200. However, maybe if you had higher estradiol, but we need data. This is the thing. Because it may be that the progesterone was too high relative to the estradiol for the vascular health, or maybe there's something about the oral progesterone in particular, but there is, no matter what, there's the concern about maybe too much GABA. Like anything, you could have too much of a good thing too, right?
Yeah.
So
I think it's very often like a balance thing. It seems to me we always, at least nature is always going back to nature. It's about balance and not having too high, too low.
I just try to replicate nature. I never think I'm smarter than nature. When is there ever this massive amount of allopregnanolone in a female body? And I don't even know how much progesterone they're getting per se after it gets converted into a lot of allopregnanolone. But if women say they need it for sleep, is that what you're hearing? They want more oral progesterone because it helps them sleep?
For example, that's one of the big ones. But for many reasons, in terms of mood or motivation, and they're just feeling, there are women out there I've spoken to, a very high dose progesterone, and they're like, that's what saved me. I'm like, wow. I think these are outliers because most
the important thing for people to know is that if you're giving the mega dosing of progesterone, this is not hormone replacement therapy. This is not. This is using progesterone as a drug, okay? This is not hormone therapy in the sense that you're replacing like menopausal therapy. This is using progesterone orally as a drug, okay, to get some unique effect for some person. But I would be concerned for those women, like, what are you really doing to your cognitive function long term because of all that allopregnanolone that you're getting? And progesterone is very neuroprotective. It creates myelin sheath. It's anti-inflammatory. I mean, I'm a fan of progesterone. I love every hormone. I want to understand it like, and I hate cliches in some ways, and I love them in other ways. But the expression balanced hormones kind of is true. You want to have the right ratios and rhythms and so on. Not that I don't do like rhythms. I mean, I do rhythms. I don't do ratios because ratios are always shifting. But you want to have something that's rational, I guess is what I'm saying. You don't want something that is so out of the ballpark of what would ever exist in nature. I just want to replicate nature. Nature always knows best. We have never outsmarted nature yet in terms of food or hormones. Now, maybe we've outsmarted them in something, but so far, mostly it's best to try to not mess too much with nature and try to live with nature.
Well, what I'm concerned about is sorry to interrupt, but when you very high dosages of progesterone, then to me, it would shut down the estrogen receptors.
Yes,
I mean,
it will. Yes, it's going to have a negative impact on estradiol. We don't even have data. I mean, there's talk about not published data. There's no published data on megadosing progesterone, except there is, but not progesterone, because okay, how do birth control pills work? Okay.
Of course,
okay.
Yeah.
Birth control pills work because of the progestin. The estrogen, which is typically, most commonly, not exclusively, ethinyl estradiol, the estrogen component that's put in birth control pills has no contraceptive benefit at all. That has nothing to do with the contraceptive benefit. It's strictly to counter some of the androgen effects of some of the progestins that are derived from testosterone, actually. And so given in high doses, they would give too much testosterone-like effect. They would create acne and facial hair. So they give the ethinyl estradiol, they give the estrogen component to increase sex hormone binding globulin to bind up the extra testosterone level. So it's it's a funny thing. And also to try to create regular pretend periods. But when you give progestin, and the reason that they created progestins, by the way, is because if you give progesterone, initially they couldn't even make progesterone that you could take orally. It was all digested by the stomach acid. But even when they make progesterone now that you could take orally, most women by far could never tolerate the high doses you're talking about that would be necessary to do what? Suppress ovulation. So the mechanism of birth control pills is through the progestin, the fake progesterones that are given that are actually more powerful. They're actually more powerful as a progesterone than real progesterone, okay? But they have they don't make any allopregnanolone at all. There's no conversion at all into allopregnanolone. So they have no sedating effect in the brain at all. So they give progestins, these like replacement for progesterone in high doses, and it suppresses ovulation. So it turns off the ovaries completely. And they can't do that with natural bioidentical progesterone orally because almost every woman would feel horrible. Really horrible. They would feel like they were walking zombies, okay, because of all that allopregnanolone in their brains. So that's why they use these progestins, okay. So we know that if you give really high doses, obviously these, if they're menopausal women, their ovaries aren't even working. But yes, I mean, there are effects. It's like a turn off mode. So, and it does downregulate estradiol. So, and we have no published data on giving massive, like super physiologic megadoses of progesterone. So I wouldn't really recommend that as a routine thing. Sometimes they've given high doses intravaginally and even orally to try to work on with pregnancies. But that's using it as a drug. Okay, that's not hormone therapy in menopause. That's a whole different thing. And I think it's a very big deal about the effect on estrogen that I'm glad that you brought up, because there is that yin yang thing. And in terms of sleep, I think it's really important that I think a lot of women in menopause who have trouble sleeping, it's because their estradiol levels are too low. Okay, I really think that we are way underdosing estradiol. Like even I have been somewhat underdosing it. But estradiol in the brain is essential for the production of serotonin. There are serotonin neurons in the brain that rely on estradiol for their very function and existence, and they basically kind of like shrivel up if you don't have enough estradiol. Serotonin is what, of course, the drugs SSRIs are trying to increase because they're known to be like they make you feel good, they're calming, they make you feel happier. That's serotonin. Well, what's a derivative of serotonin? Melatonin. So all melatonin is derived from serotonin. Melatonin is essential for many things in the body, many things. It's a potent antioxidant. It works on glucose regulation. It binds to the ovaries to regulate and have a big input on fertility and ovulation, and of course, sleep. Okay, so melatonin is critical for optimal sleep. So if you cannot make serotonin because you don't have enough estradiol in your brain, you will not make melatonin and you will not have good sleep. It's that simple. I think the reason that so many women in menopause are having trouble sleeping is not because they don't have enough allopregnanolone. It's because they don't have enough estradiol and they're not making enough serotonin, and then they're not making enough melatonin, which is another reason that women after menopause who have never had a problem with mood double their incidence of anxiety and depression. And if they've had a previous problem, it quadruples.